Professor Adam Finn from the University of Bristol sits on the JCVI, that's the government's advisory group on vaccines, who joins us now. It feels as if the vaccine is in a race against the new variant of the virus. Who's winning the race right now?
Well, I think that's a good analogy. We're in a race against time, and that explains the way the vaccine is being deployed. It's really too soon for the vaccine to have started having a measurable impact, but we can predict that already it's preventing cases just simply from the numbers of people who've received the vaccine, which is now approaching 1.5 million people, and the rate of infection that's occurring, which is really very high now. So there are certainly thousands of people already who have not been admitted to hospital and who will not be dying of this infection as a consequence of the program that's begun in December.
Matt Hancock was saying that the delays, if you like, to getting the vaccine rolled out even more quickly is about supply. I just wonder if that's your understanding. Why can't we get it out more quickly? Is it supply? Is it bureaucracy? Is it the actual rollout with GPs? What is it?
Well, I have to confess I'm not very close to the organisation of the operation, so I know about this as much as you in terms of what's reported in the media. In terms of what's going on locally in Bristol, we're certainly now receiving supplies of vaccine and seeing increasing numbers of people receiving those doses. And I understand that getting an operation on this scale going does take a certain amount of time, but it seems to be ramping up very quickly as far as I can establish.
Yes, it does certainly seem to be starting to increase. The House Secretary also said that they hope to start to be able to lift restrictions by spring. Do you think that's realistic?
Well, I think the strategy that we've advised the government to take, which is to immunise people who are at the highest risk of becoming sick with the infection, as well as frontline healthcare workers who are responsible for caring for them to increase resilience of the NHS, should result in less pressure, if you like, to shut things down, simply because the primary driver of the shutdown at the moment is the pressure on the NHS and the concerns that we could be confronting a situation where sick people who can be effectively treated are not able to be treated for lack of people and resources to do that. So I do think that we will see an impact on those pressures. But I think he was correct in pointing out that immunizing these people will not stop the circulation of the virus, which is going on throughout the population. So there will continue to be concerns about that beyond this first phase.
You're saying about the lift that you do think there is going to be an impact on reducing the pressure on the NHS,
yes,
and so on. But when do you think this is going to start to happen? I mean, how many people will we have to vaccinate for that to happen, and when do you think we might hit that number?
Well, it'll be a progressive thing. As I said at the beginning, I think it's already happening to an extent, but of course it's happening in the context of an epidemic that's going up. So we might be seeing a slight reduction in the number of cases, but they're still going up. What we should see, if all goes to plan, is that will it'll play a part in reducing that rate of rise and eventually help bring it down. But it is quite difficult to predict exactly how soon that will happen, because it's not just the vaccine that's influencing the number of cases, it's also people's behavior, their number of contacts, and the infectiousness of this new variant. So very tricky to predict that with very much certainty at this point. But as each week goes by, we'll be able to predict it with increasing confidence. So I suspect if you brought me on this programme in a month, I could answer that question more accurately than I can now.
OK, we'll hold you to that. We'll bring you on in a month and we'll see how we're getting on at that stage, definitely. You talked about compliance. How worried are you that people are not following the rules, and what kind of thing do you think they might be doing to break them?
Well, again, this is not something that I'm that close to. I mean, I can observe what's going on around me here in Bristol, and certainly there are a lot of people out and about walking, and you can see behind me, I'm on the harbour side here. It's a very popular place for people to come out and spend time. So my personal impression is that people are perhaps not being so careful as they might be to keep well apart at the moment, which is a very imperative need. But On the other hand, this latest lockdown has only just started, so the impact of the lockdown would be expected to be seen in another week's time.
OK. Now, there's lots of questions about the recommendations that JCVI has given, not least on the spacing of the doses, because you're saying that the second dose can be delayed for up to 12 weeks. Now, Pfizer, of course, the makers of one of the vaccines, has said there are no data to demonstrate that protection after the first dose is sustained after 21 days. I mean, do you not think you need a bit more evidence than just thinking, well, the other vaccines seem to work OK after 12 weeks, so let's hope the Pfizer one does too?
Yeah, I think in normal times you would absolutely wait for more evidence, and we're busy collecting that evidence already, as you can imagine, because there are plenty of people now who've had one dose, and we can observe their immune responses and the effectiveness over the coming couple of months. But this is not normal times, and what we have to do is extrapolate from the data we've got, based on the knowledge that we have of many other vaccines and the human immune response, and make a strategic judgment. Because the truth is that if you take a vaccine dose that you're otherwise saving to give to somebody as a second booster dose and put it into the arm of someone who's not immunized at all, you will start to induce protection in that second person. And with this rapidly rising epidemic at the moment, that is the imperative need. Essentially, if your house is on fire, you've got 2 fire extinguishers, you use them both, and you rely on there being another fire extinguisher to obtain ready for the next fire. You don't wait and plan in the way that you would when you're not in the middle of a crisis.
I completely understand the balance of risk here and the need to get things out quickly, particularly in the face of this new variant. But is there a risk, though, that the Pfizer vaccine could be less effective if spaced out to this amount?
Well, we know that the effectiveness between the first and the second dose is actually extraordinarily high. It's one of the few bits of good luck we've had in recent times, that these early vaccines are really very, very effective. And therefore, it's very implausible that protection would kind of go off a cliff, would suddenly disappear over the subsequent few weeks. We simply don't see that in other vaccines and in other diseases. And although the 2 different vaccines have a different means of working, they're basically both resulting in expression of the spike protein and inducing the same immune response. So there is actually plenty of logic to extrapolating from one to the other, particularly weighing up, as you clearly understand, that the risks against the benefits, which are absolutely concrete. We know that by giving this vaccine to people rather than keeping it in the freezer, it's inducing a benefit straight away.
There's also a lot of concern about some of the new variants and the impact this could have on the vaccine, particularly the variant we're calling the South Africa variant. What does the evidence suggest? We know, of course, that Pfizer have said that they believe that their vaccine will be effective against the South Africa variant. Do we know anything about the Oxford-AstraZeneca vaccine as well?
Well, this evidence is just starting to arrive, and there's one particular mutation in both variants, which is in the part of the spike protein which binds to human cells, which was a particular concern. We received the evidence yesterday from Pfizer that a virus with that particular mutation on its own does not escape, if you like, from the immunity induced by their vaccine. So as far as it goes, that's a very encouraging first step. And I think we will see over the coming week or the next few days more evidence on these 2 variants, hopefully confirming that. So far, so good. I think we all think that the vaccines will continue to work, and they were shown in the trials. But we're not quite 100% certain of that yet.
Fingers crossed. Talking about the variants, of course, the UK scientists picked up the variant in Kent. We've got excellent sequencing in this country. South Africa picked up on the variant emerging in their country, and we know, of course, that they've got a very good modelling programme there too because of the history with HIV. Are you worried that there could be other serious variants in other countries that we just simply don't know about yet?
Well, I think we know that this virus varies, and it was already varying before these two particular variants were described, and that's going to continue to happen. I think it would be better if other countries had more resources to do the genotyping, and it may well be that these variants are circulating more widely than we know about simply because people have not been able to look. But looking forwards, I think we have to anticipate the likelihood actually that there will be further variation, and that in due course we'll have to modify the vaccines to sort of keep up with the virus. That's pretty much an expectation. But it's something that we can do, and the more people are able to monitor the variations going on around the world, the more quickly we'll be able to do that.
Yeah, it's quite interesting to hear Matt Hancock say earlier in the programme that people could expect to get the flu vaccine and the COVID vaccine, for the foreseeable future to protect them as things mutate. Just finally, the JCVI has recommended that the most vulnerable get priority to the vaccine first, which, of course, everyone can understand that's the most likely to bring down the death rate as quickly as possible. Is there an argument, though, that some key workers should be prioritised? I'm thinking particularly of teachers to get schools reopened.
Yeah, as a paediatrician, I'm extremely keen that we can try and reopen schools and then keep them open. And absolutely, that's the next phase of the programme. And JCVI will be discussing over the coming month, phase 2, if you like, as to who should be prioritised next. These considerations start to be social values in a way, more than the criteria we normally use, which is pressure on the health service. There are broader considerations when it comes to people with different occupations and the relative importance of them in society. But I would certainly be a strong advocate for schools and teachers.
So you think that JCVI could recommend that teachers get moved up the queue then, quite soon?
Well, I can't predict exactly what will be prioritised, but I can say that we will be discussing this and coming up with a plan. And I can also say that when it comes to teachers, I think we all appreciate the critical role that they all play. And so that really will figure in the discussions. And
when are those discussions happening?
Well, we're meeting next Thursday. We're meeting every week at the moment. And our chair has instructed us that we must come up with a phase 2 plan by the middle of February.
Really interesting to talk. Thank you very much for letting us know. That would be welcome news to some teachers, I can imagine, as well. Thank you for being on.
Pleasure. Nice to talk.